2025 Nurse Aide exam. Let's get started. When getting ready to make a bed, the nurse aide should place the clean linens on. Is it A, a chair or table beside the bed? Or B, the roommate's bed? Could it be C, a clean surface in the bathroom? Or lastly D, the floor beside the bed? The correct answer is A. Here is why. Clean linens must be kept away from contamination. Placing them on nearby furniture keeps them accessible and hygienic. Using the roommate's bed violates their personal space and risks cross-contamination. A bathroom surface, even if clean, is in an area with higher pathogen exposure from aerosols and moisture. The floor is heavily contaminated and should never be used for storing clean supplies. Next question. The only purpose for using a restraint is to: is it A, ensure the safety of the client or others? Or B, make the nurse aide's job easier? Could it be C, calm a client who is verbally abusive? Or lastly D, help the client be quiet? The correct answer is A. Here is why. Restraints are an extreme, last resort measure strictly limited to preventing imminent physical harm when all other interventions have failed. Using them for staff convenience is unethical and illegal. Verbally abusive behavior does not justify physical restraint. De-escalation techniques should be used. Restraining a client simply to quiet them violates their rights and constitutes abuse. Next question. Articles contaminated with blood or body fluids should be disposed of in the: is it A, soiled linen basket? Or B, biohazard container? Could it be C, soiled utility room? Or lastly D, client's room trash container? The correct answer is B. Here is why. Items saturated with blood or body fluids require special handling in designated, leak-proof, labeled biohazard containers to protect staff and the environment. The general soiled linen basket is for linens, not sharps or heavily contaminated disposable items. The soiled utility room is a location, not a specific container. Biohazard waste within that room must still go into the proper receptacle. The regular room trash is for non-hazardous waste and poses an infection risk if used for biohazard materials. Next question. To avoid pulling the indwelling urethral catheter when turning a client, the catheter tubing should be secured to the client's: is it A, bed sheet? Or B, upper thigh? Could it be C, bed frame? Or lastly D, hip? The correct answer is B. Here is why. Securing the catheter tubing to the client's upper thigh with a securement device allows the tubing to move with the client, preventing tension and trauma to the urethra. Attaching it to the bed sheet can cause pulling when the client moves or the sheet is adjusted. Anchoring it to the stationary bed frame creates a fixed point that will tug on the catheter when the client moves. Securing it to the hip is less stable and not the standard, evidence-based site for securement. Next question. When collecting a 24-hour urine sample for a client, the nurse aide should request that the client: is it A, take a bath or shower before starting the urine collection? Or B, select food items that do not contain red meat? Could it be C, drink 2 L of water? Or lastly D, discard the first voided urine? The correct answer is D. Here is why. A 24-hour collection starts with an empty bladder. The first urine voided at the start time is discarded, and all urine produced thereafter for the next 24 hours is saved. Bathing is not a specific requirement for urine collection protocols. Dietary restrictions, like avoiding red meat, are sometimes ordered for specific tests, e.g., creatinine clearance, but are not a universal step for all 24-hour collections. Instructing a fixed fluid intake, 2L, could alter the test results. Clients should maintain their usual intake unless otherwise ordered. Next question. When ambulating the client, the nurse aide should: Is it A, ask the nurse for help? Or B, be sure the client is wearing non-skid footwear? Could it be C, ask a family member for assistance? Or lastly D, walk in front of the client and show the client the way? The correct answer is B. Here is why. Proper footwear is a fundamental safety measure to prevent slips and falls during ambulation. While asking the nurse for help may be necessary for some high-risk clients, it is not the universal first step for all ambulation. Relying on a family member for assistance shifts the professional responsibility, and they may not be trained in safe transfer techniques. Walking in front of the client does not allow the aide to provide physical support or observe the client's gait and stability. The aide should typically walk to the side and slightly behind. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.